been in this FMER Advanced webinar, the last of this current year, not the academic year, the year in general. And we are very happy and very honored to have two international speakers from Malaysia and from Egypt. So what they have in common, besides the fact that they are family physicians, is that they are members of the WONCA Education Party, and they have both participated in the development of this WONCA report on the standards for postgraduate education in family medicine. As you know, we are in Canada in the middle of this pan-Canadian conversation of the family medicine residency program reform, extremely politicized, I would say, but anyways, we are there. And as I said before to our speakers, Chandra and Nadwa, Keith is the leader of the project here at McGill. Each one of the 17 departments of family medicine in the country, they are developing something regarding this initiative. So we thought that it would be great to have you, just to have this, what you have, this international perspective on this reform that is not only affecting Canada, but other countries in the world. So for the audience, you have the excellent bios, fantastic track records of these two speakers, and I think I will stop. Just remind that the way that we function, you know that the speakers speak 30, 40 minutes more or less. We left the question and answers for at the end. Denise and I will check in the chat, and the session will be recorded because then we post it on our website. Okay, so I think I will stop here. Chandra, Nadwa, once again, yes. Thank you very much for accepting my invitation, and the Zoom floor is yours.
Thank you very much for the kind introduction, Dennis, and a very good afternoon and a hello to everyone in Canada. My name is Chandra, and I believe we are in 3 different time zones across the world, Nagwa in Egypt and myself in Malaysia. Both Nagwa and I are very glad to have been given this opportunity to present at a McGill Family Medicine Education Research Group webinar today, and we are indeed honored. We understand that this esteemed research group supports the development of family medicine research and ultimately the enhancement of family medicine practice. Being members of WONCA, both Nagwa and myself, can also resonate with this theme. We hope that today's webinar would help participants to reflect on the nuances of family medicine practice, especially from a cultural and social context globally. Today, we will be sharing our experiences on the WONCA Global Standards for Postgraduate Family Medicine Education. In order to spark discussion and create a more collaborative learning experience for everyone, as well as to gather valuable input and feedback from the participants, Nagwa has so kindly created an interaction using the Mentor-Mentee app. So kindly scan the QR code on the screen and answer the questions. Thank you. In our presentation today, is that enough time, Nakwa?
Yeah, just a second. I'll share it in.
Yeah, let me know when yeah.
Just a second. So first of all, how do you feel today? You can refresh. Okay, wow.
Oh, tired.
It's early in the morning there. Wow. So this is nice because this is If you have a problem, I can send you.
Just okay.
That's good. Yeah, happy.
Okay. Seems you're going to have only. Okay, thank you. At least you have someone happy here. Okay, let's move to the next one. My pre-existing knowledge on this topic. How do you rate your knowledge about, how do you describe your pre-existing knowledge on the WONCA standards? Okay, you still can scan the QR code if you didn't and share with this. Okay, so thank you for this one. And read the following. How well are you prepared for this session? What do you think? Being tired. Okay. Also. Okay. Let's move to the last one for this session, which is about what do you want to learn from us? What is your expectation for this session? Okay. The first response is how are we thinking about the international standards? The second response would be an overview on the domains, as I know a little bit about this point, recommendation for further inquiry. Okay, thank you. Better understanding of what other countries do when preparing the future family doctors. Okay, that's perfect. Thank you. Okay, we can stop here. And over to you, Chandra. Let me share the presentation.
Thank you, Nakwa. Next slide, please. Yeah. So in our presentation today, we will cover the following areas. What is WONCA? Who we are? WONCA Global Postgraduate Standards background. Standards versus curriculum. Benchmarks and benchmarking. And the WONCA Postgraduate Medical Education Standards. Next slide, please. So what is WONCA? WONCA stands for the World Organization of Family Doctors. It is a not-for-profit organization and was founded in 1972 by member organizations in 18 countries. WONCA now has 118 member organizations in 131 countries and territories, with membership of about 500,000 family doctors. WONCA's mission is to promote personal, comprehensive, and continuing care for the individual and the family in the context of the community and society. To promote gender equity and respect through the equitable treatment, inclusion, and meaningful advancement of all groups in the context of healthcare and societal initiatives. To encourage and support the development of academic organizations of general practitioners all around the world. To provide a forum for exchange of knowledge and information between member organizations and generally all general practitioners. And WONCA is the advocate for the policies, the educational, the research and service provision activities of general practitioners to the other world organizations and to the World Health Organization, WHO. So overall, WONCA strives to improve the quality of life of the peoples of the world by promoting high standards of care in general practice family medicine. Next slide, please. So this is WONCA's structure. WONCA is governed by a World Council that meets once every 2 to 3 years. WONCA is comprised of 7 regions, and each region having their own regional councils and conducting their own regional activities, including regional conferences. These 7 regions are Africa, Asia Pacific, East Mediterranean, Europe, Ibero-Americana, North America, and South Asia. WONCA has several working parties as well, and also special interest groups and a young doctors movement. These groups promote specific areas of interest to WONCA and its members. So who are we? Till October this year, I represented the Asia Pacific region on the WONCA Working Party on Education, or the WWPE as it is called. I have just finished my tenure as the Asia Pacific representative. Dr. Nagwa remains on the Working Party for Education and represents the East Mediterranean region. She is currently also the chair of the WONCA Working Party on Education. So that's a lovely photograph of us at one of the monthly meetings that we had. Yeah, and Nagwa was clever enough to get one of these photographs just in time before I left, yeah. So I'll hand the presentation over to Nagwa, and Nagwa will take you through the rest of the presentation. Thank you.
Thank you, Chandra, and hello everyone, and good afternoon and good evening, depending on the time we have. And minor correction, I'm the elected chair of the WONCA Working Party for Education, not the chair. The Vector is the chair right now, and I'm the elected chair who is going to shadow Vector for the next 2 years and then handle after that, just to make sure that we are all on the same page. So first of all, there is a current need for quality assurance in medical education. Why do we need to have a quality assurance? Because we need to help the health profession to work in an increasingly complex healthcare scenarios. So we need to make sure that we are doing the right thing. There is an increased demand and expectation from the public as well as employing authorities from the product that we are producing from the medical schools. So we need to make sure that we are providing them with the right product that meets the expectation of the public, the communities, as well as the the authorities. Also to ensure that the standards are comparable internationally. So we need to make sure that we are all speaking the same language and we are all targeting the same objective. As well as there is an important point, which is that newly qualified health professions must possess qualities that meet these expectations. So in order to make sure that we are going with all of these, we need to have a quality assurance in medical education. So this came the WONCA Global Postgraduate Standards. What is the history behind this issue? The history simply started with World Federation of Medical Education, the WFME. The WFME had provided us with the foundation of an initial standards. The aim of the standards was for the postgraduate in general. We had took these standards, and then this initial standard had been working upon since 2006 and completed and endorsed by WONCA World in 2013 in Prague. Then an updated version had been done in the past year. The aim of the updated version is to suit the requirements that we are facing right now. And I'm going to talk about this later. So what is the purpose of these standards? The purpose simply is we can use it as a self-assessment, as a quality improvement when we are going to develop a new program, and if you are going to do a peer review for each other, and if you would like to go for an accreditation. I'm going to go in details for each one of these later. So the idea started with the World Federation of Medical Education when they provided these global standards, and we took them to work on them. The person who started this was Alan Wash, then followed by Prof. Alan Wash, followed by Prof. Michael Kidd, and then Valwas, and finally our group who had been working on the updated version for the 2023. In order to make sure that we are all following each other, I need to that we are having the same specific terminologies that we are following, because while we are preparing for the updated version, we noticed that there is a misdefinition between some of the people about what we would like to achieve. So there is a difference between the standard and the curriculum, because the standard is the broad learning goals or the expectation outlining what you would like the student to do, to know, to understand, and to be able to do into a specific grade level. So in year 1, in year 2, in year whatever, and within a certain subject, you would like them to do this in subject X or Y, and when is the level that they need to do this. So this is the standard, which is about the learning goals and expectation. The curriculum is an organized plan of instruction, compromised units that engages the students in mastering these standards. So we are talking here about the what and the how. The what is exactly what we would like our students to learn, and the how is the curriculum that is going to implement this, because this is very important. Why? All of us in the world, we have diverse clinical family medicine practices all around the world, diverse trainings, diverse certificates, and so on. You cannot unify the training, the certificate all over the world, but you can unify the standards where each training or each certificate can work upon in order to achieve these standards, okay? The another point that I would like to make sure of that we are following is when we are the postgraduate medication, then we find this as the phase in which the doctor train under supervision toward independent practice after completing their basic medical education, their basic medical qualification. It comprises of pre-registration, professional training, specialized, sub-specialized training, and also to be having these other competences within the training program. When you complete this formal training, then you are going to obtain a degree or a certificate. This depends on the policy and legislation in the country you are taking this part in. So when we are doing this, when we are having these standards, there are an important point that comes to our mind, which is the benchmarks and the benchmarking. Benchmarks are the reference points or the measurement of comparison. So WONCA Working Party for Education, it came up with the global standard for the postgraduate family medicine. So this is the benchmark. So could be considered the benchmark. Benchmarking is the processing of finding the good practice and learning from others. So you are going to take this and adapt it to your own practice and try to familiarize with what's happening. So benchmarking is also a means of measuring the performance against a comparable institution. So when we are talking about the postgraduate medical education standards, we have 9 areas and we have 38 sub-areas. The main 9 areas are the missions and the outcome, the training process, assessment of trainees, staffing, training settings, and educational resources, evaluation of the training process, governance and administration, continuous renewal. These were the main 9 areas that were adopted in order to make sure that we have the global standards according to the WFME and so on. Each one of these areas actually had sub-areas behind it, and we are going to discover that while we are working right now. So the WONCA standards, simply, it has 2 levels. When we designed this, we had 2 levels. We have the basic level and the quality level. What do we mean by the basic level? It is the fundamental for all the programs. So if I'm going to check what you are going to do, and I find that you don't have this basic, then I'm not going to go into the quality part. If you don't have a family health training center, if you don't have a specific training program specs, if you don't, so these are something that we consider the basic. If you don't have the basic, then I'm not going to go into the quality level. The quality level is the more high advanced level than the basic, which is about the greater expertise and the resources that are highly desirable in order to take this forward. So I'm having this community-based education, I'm having this community-based training, I am having this, all of the students have their e-portfolios, all of the students are practicing the training within the family health centers all the time, and so I'm having all the quality advanced part. All of this, as we said, is organized into 9 areas. The purpose of this medicine as a central of training to the family medicine, to program the program quality improvement, to the program's need to respond to the community needs, because the family medicine lies within the community, and it is within the context of the community, within the context of the surrounding of the country. So in order to make sure that you are doing the right thing within the context of the family, within the context of the community, you need to make sure that your program is responsive to the community needs and the learner-centered program. So this is the purpose of the standards that had been developed. What are the potential uses of these standards when you are going to develop a new program? If you are going to develop a new program, you need first of all to start thinking, what is the mission? What is the vision of what I'm doing? What is the training aspect? Where I'm going to train, how I'm going to train, who is going to train, on what I'm going to train, what are the competences that I need them to gain, what is the governance process of this issue, of this training, what is the assessment, what is the learning, when is the assessment going to be? It's assessment for learning or assessment of learning, how? So so the standards is providing you with a framework in order to design your program in a correct way. It also could be used as a self-assessment when you can stop for a minute and do a reflection on the program. Am I doing the right thing? Does my program comply with the standards or comply of what I would like to achieve? Also can use it for a peer review when I can review other schools if you would like to make sure that we are following a good way of standards. Accreditation of the programs and WONCA accreditation. Actually, these standards are part of the WONCA accreditation for some of the programs, where any institute can submit a request to take the accreditation of the WONCA. And then this goes within a review of the documentation, a visit, in order to make sure that things are going within the right track. So I can use this for an accreditation, okay? So let's go through the 9 areas simply. For an example, when we are talking about the first one, which is the mission, the vision, and the outcome. Do you have a mission statement or not? What are the program goals that you would like to achieve from this program? What are the outcomes? What is the indicator or the proxy? What are the measures that you are going to use? All of these are parts of the checklist, because the checklist has a specific design that I'm going to show you right now, where we have the area, and then we have the sub areas, and each sub area has a specific indicator, and then we are going to say, if this should happen, I'm going to tick right. If this is must happen, I'm going to tick right. If it doesn't happen, then I'm going to write that it didn't happen. And this is what we are going to show you right now. The training process. The training process, you need in the training process to comply with the following subclasses. You need to make sure that you have your learning approaches in the correct way. You have the scientific way, the training content, the training structure, composition and the duration, relationship between the training and the service that is provided, and management of the training. All of these are the sub areas within the training process. Assessment. For the assessment, we are looking within the standards of assessment, the relation between the assessment and the training, because you know that we have a constructive alignment and you need to teach what they are going to be assessed on and what they are going to deal with within the community. So what is the relation between the assessment and the training? How the training went and how the assessment is going to happen, and does it comply with the way that they had been trained or not? And feedback to the trainees about the assessment method, about their performance, about what they have done good and what they didn't do well. So this is an example for the checklist. For an example, as we have suggested, there is an assessment method, relationship between the assessment and the training, and feedback for the training. So what we'd like to say is that, for an example, okay, so as you see here, there is a must and there is a should. Okay, so for an assessment methods, method and process is clearly defined. Method includes formative and constructive feedback. So this is a must, okay? So if the institution has this, then this is good. I'm going to go into the next level, which is reliability and validity of the methods are documented. External family medicine examiners are included. Complementary set of methods are applied. Lookbook and portfolio is used to record the stages and acquisition of the skills. Appeal mechanism is present. Supplemental training is supplied if needed. So for each of these sub area, I have a specific things that I have to take within the checklist. So I need to make sure for each item that I'm having this, because this reflects that the standard is going within the correct way. So each standard has a sub area under it. For an example, a relationship between the assessment and the training must have the assessment is compatible with the training objective. So for the training objective, you would like the students to do a comprehensive history taking. So the assessment is an OSCE on a patient. You want the student to do a communication or show empathy while dealing or having a breaking bad news or whatever. So you have an OSCE station on X and Y. So this is compatible with the training objective. Promotes learning. Documents progress through the program. So I'm having documents that are progressive during the program, and everything I'm doing is documented. Also, the documents Also, the documents readiness to practice the family medicine at the completion. So I'm having all of these documents that are ready when the family medicine have ended the program. Actually, I have all what have been done in the training in the previous part and all what have been done in the assessment. Encourage integrated learning, assessment predefined practice requirement, assess knowledge, skills, and attitude, and encourage interaction between the clinical practice and assessment. Now, this is very important because when we are going to read these standards, you are going to say, okay, this is nice. How I'm going to do this, or how are you going to see that I did this? Now, this comes where we are going to talk about the self-review and the documentation, which is another document where you have a specific item where it tells you exactly what do you need for each of these standards to prepare as a documentation for the external visit when it comes. So I think I'm going to stop here just for a few seconds in order to make sure that we are all at the same way or track, where I'm going to go back again into the Mentimeter just to make sure. Do you understand everything so far? Okay. We have only one response due. I shared the link. Okay, three good. Okay, thank you. I just shared in the chat the voting link in case you didn't scan the QR code to make sure that we are all at the same page. Okay, so we have yes following us. This is perfect. So what is still unclear so far? Just to make sure if there was something unclear. Okay, perfect. Okay, perfect. So this is about Ask Me Anything, where I'm going just to stop the slide here. If you have any questions, you can post it there till we finish our presentation, okay? Then I'm going to go back to the presentation. So this is the checklist that I just elaborated about. And this is the assessment part for the checklist. Still sharing, I think it's, yeah, okay. So for an example, feedback to the trainees, we have stated this. So you must provide a constructive feedback, and coaching is given on an ongoing basis. As an accreditor, as a person who's going to check this, what I would like to see in the documentation is that there is a documented written feedback to the student, and there is a schedule for the feedback. When I'm going to go for an accreditation visit, if we are providing one, I'm going to meet the students and make sure, do they receive a feedback or not? I'm going to watch a clinical teaching sessions, and I'm going to check, do the trainees receive a constructive feedback or not? So when we are doing the accreditation, and every standard in this area is well covered. So then we go for the trainees. You need to make sure that there is an admission policy and selection for the trainee. You need to provide support and counseling, and you need to make sure about working conditions and the trainee representation. So this is broadly the sub areas, and in the specific areas, sub-areas for the checklist, you are going to find a few description about this. So what is the admission policy? Is it clear? Is it announced for the students? Is it equitable or not? Does it allow all the students to appeal if they found a problem or not? What about support and counseling? Each student must have, each institution or school should have a specific support policy and procedure, should have a specific counseling system. So all of these items is very important to check their sub-area standards. Also the staffing, the people who are providing this program, you need to have a specific appointment policy about having these people within the program. How did you choose them? Because as you checked in one of the parts in the assessment, you need to make sure that the family physician are the persons who are within the exam of and the training of these family physicians or within this program. So how did you appoint these people? How did you choose them? Why? Protected time for the trainers to train the trainees. So you cannot get someone who is a full duty and have a huge workload and ask this person to train 5 trainees, and they are going to shadow this person or this trainer for something like 1 year or 5 months or whatever. So this is not correct. So you have to have a protected time, training setting, and educational resources. And this is one of the main items where we had developed the change from the WIFME, because in this part we have been making sure that we have a training within the family medicine centers or within the primary healthcare centers, because this is the specialized place where they are going to work. So the clinical settings, the patient volumes per day. So what is the amount of the patient that they are saying, the numbers, the time, the physical facilities and equipment, the clinical team that is working, the IT, research, educational expertise, training in elective and other settings. All of these are the sub-areas for the training and setting. Then we come into the program evaluation, and the program evaluation is completely different from the assessment, because the assessment is the assessment of the students, assessment of learning and assessment for learning. Meanwhile, the program evaluation focuses about the program itself and what's happening within this program. So you have the program report, so you have the results of the assessment, you have the feedback of the students, you have the feedback of the faculty, of the staff who's dealing with, for the patients, for the community, for the stakeholders, and so on. And we have the governance and administration. So what is the governance and administrations? How things are going within this part? What is the curriculum governance? Who is responsible for this? So the process leading to a decision maker are based on open discussion, transparency, shared governance, and alternative consensus development. So this is very important in order to make sure that we are doing the right thing. We need to have the program evaluate, the governance and the administration within the right way. Also the continuous renewal, including external review. This is very important. So did you have someone who is revising your curriculum and who is revising your training and doing and checking if this is something you need to change within this part or not? So this is another important point. And another element, and this element is very important because this is what led us to do the renewal and the update of the standards in 2023. Why? I'm going to tell you this, but just a few seconds later, after a couple of slides. So this is simply about what the documentation that you need to have in order to make sure that things are within the place. This is the program pre-visit questionnaire. So for an example, for the mission and outcome, you need to provide the copies of the accreditation documents or statement in which define the basis for the outcome objectives in family medicine postgraduate education. You need to describe the process by which these have been developed and renewed. You need to provide a document containing the competences that the trainees are required to achieve as a result of their training program. For the training process, as I said earlier, you need to describe the prescribed training program, including the family medicine specific components and any additional experiences or placement that both clinical and non-clinical. What are the required degree or involvement of family medicine training program and family physician teachers in each of these experiences? What is the expected role of the trainee in delivering the patient care? Because, in some places, you are leaving, we saw that in some places, some of the trainees are left within the service providing a full care for the patient, which is incorrect because they are not working within that place unless you have a policy that says that they are part and they are in a contract with the place and they can provide care. So this is something very important. What is the expected role in the delivery of the patient care? This is something very important within the practice, and we found some difficulties in it. How's the trainee supervision, feedback, assessment organized within the clinical component of the program? So for an example, I'm seeing the patient, I'm seeing the student, I'm having this student for 1 month. I'm going to provide the feedback on DOPS, direct observation procedure, once per week, and he's going to be assessed, or she is going to be assessed by the end of the rotation via OSCE and written exam. So I need to have a clear statement, clear policy, what's happening within this assessment and within the training of these students. In what way the program expected to provide the trainees with gradual increasing responsibility over training? So in the first year, he is only observer. In the second year, the student is going to be is going to be under observation, taking the history. In the third year, he is going to do, so what exactly are you going to provide within the training? What is the responsibility? Are you providing ABAs, entrustable professional activities? So are you going to do a competency and a milestones? Or are you going to have still doing an outcome-based curriculum? So you are going to do it with an under observation, observer, under observation, without observation, and so on. You need to define this level of responsibility according to your own context. So as you see, these are broad things where you can tailor according to your place. And then describe the expected balance between the clinical service and the education in the program, and how programs are required to monitor this. How are the educational programs organized in your context, and what are the requirements for governance and accountability? And this is very, very, very important. What is the required role of the trainees and other stakeholders in the governance for this program? This is very important. So these are the items that I need as an audit, as an accredited person who's going to check, as a peer review, that I need to see this documentation in order to make sure that the process is going correct. So you are not going to take only by observation. You are going to take after visiting the place, after checking the documentation, after making sure by triangulation that all of these steps have been or had been or working or doing it in the correct way. As I said earlier, we needed to do an update in 2023. Why did we do an update in 2023? We needed to do this for 3 reasons. The first reason was because COVID-19. And COVID-19 had elaborated into an online learning. So we needed to implement and integrate, articulate this part within the standards. And this was one of the updates that we had included. Also, we had included another point about the patient safety. And finally, we started this webinar by asking you, how do you feel? And you have told us that most of you actually is feeling tired. And this is one of the things that we had tackled, and in the standards, it's about the physician well-being, because it's not always about what you are going to train and what you are going to learn. You need to make sure that actually the well-being of the physicians is within the correct way. So the advances or the things that we have been done is the trainee renomination, because as we said, they are trainee within the place. So you need to make sure that they are taking the correct incentives for what they are doing, the trainee wellness and well-being, and the IT resources for teaching and assessment, because based on COVID, we all had moved into the online environment, and actually we started to implement the online as part of the curriculum. So general framework. medicine, family medicine
Excuse me,
training
Nadwa,
program.
we are only 10 minutes left.
Yeah.
Because I would like to leave some minutes for questions from the audience. So it's already, we have 10 minutes left. Okay. So, okay. Thank you.
Okay.
Go
So
ahead.
this is the last slide. Okay. It's about ensuring quality and providing incentives, pathway, and sorry for taking so long.
No, sorry, don't worry at all. It has been a terrific presentation, both you, Dr. Turi Siham and Dr. Hihasi. Okay, so I think I got it. So thank you so much. A very, very dense, a lot of presentation, a lot of things to think about it. So I have several questions to ask, but I will first open the period of QA for to the audience. So please go ahead. There is anybody in the Zoom floor that would like to ask something, some clarifications. I think maybe I will start myself, whereas people are thinking about it. As you have said from the very beginning.
And in case that they, yeah, okay.
No, go ahead, please. Go ahead.
I'm just going to say, if they have a question, then they can leave us in the Mentimeter one key take-home message and what they enjoy the most about the presentation. If they don't have questions, so they have either to have a question or answer this part. Yeah.
Okay. But I have questions. So definitely this is a framework for, as you have said at the end, the take-home message to develop new curriculum and then to assure its quality over time, right? But I think every country has an accreditation. No, Keith, correct me if I'm wrong. Any program that we implement in Canada in postgraduate education, we need the accreditation by the College of Family Physicians of Canada, and many of the things that you have presented and discussed are already present in this accreditation process. So my question could be, what could be now, for example, that we are in the process of gathering information for developing a new family medicine residency program in Canada, or more particularly in McGill? What would be the advantage for us to adhere to this framework in order to obtain a WONCA accreditation? Maybe it's more a political question, but it's something that, because if I well understood your presentation, it's a very labor-intensive process to obtain WONCA accreditation, right? When, in order to implement a new curricula in our context, we will have to go through a local, national College of Family Physicians accreditation already. I don't know if I explain myself correctly.
I will try to make sure. So you were asking about having a WONCA accreditation for the new program, right?
What would be the must for us to have, in addition to the College of Family Physicians of Canada accreditation, to also have WONCA accreditation, because it's a very labor-intensive process?
Okay. First of all, the accreditation cannot be done only for the old programs, for the new programs. It can be done for the old program as well as for the new program.
Okay.
The second point is that WONCA is the World Organization of the Family Doctors. So it is the sound of the family medicine all around the world. It's not within a specific country. And this is one of the reasons for the standards, because the standards, it's unify what is the essential things that you need. You may excel and do much more things, but this is the basic that you can implement in order to have a qualified family physician. One of the things that we have discussed during our meeting is about the duration. I cannot interfere with the duration of any country, but I would recommend at least 2 years of training. Less than that wouldn't be enough to have a qualified family physician. What can WONCA accreditation add? As I said, the aim of the postgraduate, different purposes. One of them, the accreditation. you may not use the accreditation. You may use the tool to make sure that you are providing the correct family medicine program. And you may go for the accreditation in order to have a branding effect that you have the accreditation of the Canadian College as well as for the WONCA. So this could be something branding and add value, as we say. And you may not use this and only utilize the standards to make sure that your program is adherent to the standards.
Okay, so now I understand a little bit more. Another question, if there is anybody that would like to ask something, Keith, Michelle, or any student?
Well, it struck me, I think it's an interesting point, the duration question, and that's a tough one. And I know Charo and I have talked a lot about duration, and I guess, you know, time is one thing, but the contents of that curriculum and what the trainees are actually doing are also hugely important aspects of the training program. And so I'm just wondering how you're considering, because to me, it's not just about family medicine residency training, but also about the entire medical school training and what exposure they have through that, plus their residency. So I don't know how you're thinking about that, but that's certainly a hot topic.
Yeah, it's certainly a hot topic. And I have to say, when I said 2 years, it was not just, it was just a recommendation. It was not a cutoff point. And why did I say that recommendation? Because while we're revising the standards, we have this task force group, and it has people from Europe, from Africa, from all over the countries. And we were faced about that they were talking that there has been something like 6 months, 1 year training programs, and the persons are qualified as family medicine specialists. So they were raising the point that, is that enough or not? We have been discussing that in order to you have a very valid point, which is about the quality of the training and the content of the training. But the point that we have been discussing, does this qualify the physician to be a specialized family physician? Does 6 months training qualify anyone who doesn't have background, only just the basic medical qualification, to be a specialized family physician? So that was the answer why we said 2 years. Okay, so if you have someone who had been working for something like 1 year or 2 years and then had a qualification for 6 months and whatever, this is up to you within your country. But we were talking about specialized family physician. This is, you need to have a comprehensive training for a specific duration. Is that clear? Does this answer your question?
Yeah. So it's a policy, a WONCA statement that to be a specialized family physician, the postgraduate training should be minimum 3 years, is what I understand.
2 years.
2 years, sorry, 2 years. Okay,
2 years.
Okay.
And
Okay,
it's
2
a
years.
recommendation. It's a recommendation.
Minimum 2 years.
When we were discussing this thing within the group and within the different, they thought this should be within the standard. But we understand that there is a different country context. Okay. And there are some countries that doesn't have any family physician. So we cannot force anyone, but we can say a recommendation. And we didn't just yet publish the 2023 standards, but this is going to be one of the things that we do recommend, but we cannot force anyone to comply with this. And that's why we didn't put it within the standards.
Okay. I would have, before we leave, another question. You have talked about, because the focus as a quality, constant quality improvement program is on the process of learning, right? And how the program is managed. But has WONCA any recommendation regarding the content? And I get back, Michelle, to what you commented yesterday in our working session. For instance, in Canada, we can be very interested in Indigenous health, but it's something that it could be interesting, I don't know, in France or in Spain or in UK. has WONCA a position regarding the content of what a good a specialist in family medicine should have during their postgraduate education or not?
I would say that we have published a book about family medicine in the undergraduate curriculum, and we said that this could be something like a guide for the minimum that is required for family physician in the undergraduate curriculum, but we didn't have something about the post. Very diverse topic from country to country, and it's hard to
establish
Yeah, okay. Yeah. I will tell you something. I am, as a family physician, I'm also working at the WOMP as a WHO IMRU consultant for family medicine regional professional diploma within the Middle East.
Okay.
Within the Middle East, we have a specific topics. So we have something like mental health, we have something like women, we have something like children, and in each, and this is diploma is 2 years, and we have a specific area for each of these modules for a country context.
Okay, I understand.
So we are providing for a mental health depression. Yes, Michelle, I'm sorry.
Michelle, go ahead.
But just to follow up, so I understand country by country that would be very daunting. So I appreciate that. But you know, has WONCA ever thought about looking at regional differences of where priorities lie in terms of, you know, what is, you know, what's maybe lacking in the curriculum and, you know, where, etc.
Actually, this is one of the things that we have discussed about, because the content is very difficult to put in, and the priorities, as you said, this is something very tricky, because the policymaker and the health policy and the institution that are providing health, there is a different demands and different strategies in each place. So if I'm going to say that I'm going to prioritize the primary healthcare services, then the tertiary are going to say, no, you have to check X and Y. So it's not going to be the way of talking and the way of the outcome that you would like to achieve.
Definitely. No, that makes sense.
You have a couple of comments in the chat, Charo. I don't know.
Sorry.
Sarah wants to say anything.
Sarah, I will read it. Sarah is a practicing family physician, is an FMER alumni. She finished a couple of years ago her master's in family medicine. I was wondering in what context we are pleasured with this present. I think accreditation from WONCA is interesting, if not important, in the context of family medicine in the world now. I suppose the world needs excellent experience and numerous family physicians more than ever. And to be together for that, I think that in this context, Charo's question is very pertinent. Thank you for being able to participate in this seminar. That was the very first question we had to face in Brazil, because she was living in Brazil for a long time. When I was involved, there is the definition of qualification needed for family physicians for the country and the family health program there. I'm talking about the process of qualification from a general formation to specialty. Sarah, you are there. You would like to add something to what you have put on the chat? Go ahead, Sarah, please. And we finish with you because we are running out of time. Okay, go ahead, Sarah.
No, I was just wanting to make a commentary on what it was asked and everything. I think I understand what is the purpose of this presentation, but I mean, I have been able to participate in Iberic America of some events promoted by WONCA, even participates to the local organization to some of them. And what we talked about during this chat was really the same preoccupation we had over there. So I just realized that WONCA had those preoccupations at that time and still have them, and it's still the same challenges that we are facing, even if I've been more than 10 years ago that I've been more involved in that. So I just wanted to make a commentary to wrap up and say that was the work of the WONCA at that time, and it seems to be the same purpose that are looked for.
Thank you, Sarah. Unfortunately, we must finish here, so I would like to once again thank you, our speakers, for your effort. I know that it's very late in your respective countries, so thank you very much for accepting our invitation. Definitely, this presentation will be very useful for us, that we are in this process of gathering data for creating the most fantastic family medicine residency program in the world at McGill. So thank you very much for your input. And I really hope that we will keep in touch. Okay, so it's not just an invitation and that's all. I really hope that we will maintain the contact. And once again, thank you so much. And thank you to all the attendees. We will keep discussing about all this.
Thank you very much, Charo and Dennis.
Thanks very much, Charo, and everybody.
Take
And
care.
good